At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky. Welcome back to another edition of Healthcare Today with the HSA. I'm your host, Chuck Taylor, and I want to thank you once again for tuning in. And this week, it's all about World Breastfeeding Week. I know you're thinking, wow, the week goes by, August has jumped through, but this happens each and every year from the 1st till the 7th of August in more than 120 countries. So I have some wonderful nurses in the house with me today. Miss Carol, hello, how are you?
I'm very well, thank you for inviting us.
And Miss Renae, how are you?
I'm good, thank you for having me.
Excellent. So let's jump right into it. What is World Breastfeeding Week?
So it's an annual celebration, which is every year throughout the world, this year being from the 1st to the 7th of August, and it takes place in more than 120 countries. So it was initiated by the World Alliance for Breastfeeding Action back in 1992, and it aims to inform and engage and discuss breastfeeding and hopefully increase the rates throughout the world.
The thing about it is, as we talk about it, we consider the world to be modern, and breastfeeding, is that something that they should consider automatically? Because I know a lot of parents, they look at, infant milk and all these other substitutes. Is breastfeeding the best way to go?
Yes, because ultimately breast milk is made for babies. Mm-hmm. Formula milk is cow's milk, which has been modified for babies. So therefore, the sort of gold standard is breastfeeding, yes. And we know it's not easy for everybody and it can have its challenges, but ultimately it's best for the mums and the babies. There's various benefits to mums and babies. Mm-hmm. So, for example, for babies, it's known that the babies are likely to have less hospital admissions with infections. You get babies with less diarrhea and vomiting. It's also related to it reduces the rate of sudden infant death syndrome, so what was used to be called cot deaths. Mm-hmm. Also, it reduces childhood obesity and has been shown to reduce cardiac heart problems in adulthood. There are links that it may reduce the chances of leukemia, mm-hmm. diabetes, which is known as sugar here, and heart disease and asthma. So a lot of benefits for the babies. Okay. There's also got benefits for mum. So it's been shown, research has shown that it reduces the risk of mum getting breast cancer, ovarian cancers, osteoporosis, so weak bones sort of later in life, mm-hmm. heart disease, obesity, and it also is good for high blood pressure. Wow. And we see that in practice, because if you do a woman's blood pressure when she's breastfeeding, you can see it go down. So right. We've seen that ourselves.
Okay.
So, got those benefits.
As you said, it's a benefit for the overall mother and child to do it the natural way.
Yes.
Excellent.
And just to go back to your point of it being natural, and I know when you think of natural, it's supposed to, you're probably thinking it should happen automatically. But it might start off with a high learning curve. So mom and baby might have to become familiar with each other. Mom will have to learn how to hold the baby will have to learn how to get to the breast and that sort of thing. But once there is support, the right support for mom and baby, as soon as mom and baby is comfortable, then it gets a lot easier for the
And I think that would be the key, is to make it that both mom and child get to that familiarity of doing it. I mean, I remember back in time, a woman breastfeeding in public was very taboo. It was almost a situation where people are like, why are you doing this? But now, because it's a natural thing.
Yeah.
The child is hungry.
Yes.
and you are the provider of this child. So I think, and there was a time I remember in a lot of businesses, and I speaking from the U.S. aspect, because traveling up there, they actually had signs saying breastfeeding welcome. And I was thinking, why would you actually even need to place a sign up there saying that? But then I do realize now, as I went in different places, like, wow, there's still a stigma of this, and it shouldn't be. It's for the benefit of a child.
Yes, and so we're still at a point in society where we're still asking moms to cover up to breastfeed. Now, if mom decides she wants to cover up when breastfeeding in public, then that's her choice. But I don't think it should be a taboo where mom should feel uncomfortable if she has to feed her baby. She's providing food for her baby, comfort for her baby. Like, this baby could just need its mom at any point. She shouldn't have to feel like she has to hesitate if she needs to attend to her baby's needs. Now, on the point of support, the theme for this year's World Breastfeeding Week is Step Up for Breastfeeding, Educate and Support. And we still have a far way to go, if you ask me, as it relates to education and support, as it pertains to breastfeeding for the entire family. So it's not just for mom.
Right.
Mom and baby, dad, everybody needs to. It's a galvanized effort to get this breastfeeding going.
Of course, and that was just about to come to that. The theme for this year. Once again, she noted, and I'll say it. The theme for this year is World Breastfeeding Week 2022 is Step Up for Breastfeeding, Educating and Support. And part of that, in the back of my mind as a man, educating support means that I need to be there to be educated also, because I am the support. I'm supporting, my child. I'm supporting my wife, my significant other, my partner.
Absolutely.
in this endeavor. And that means I need to learn as much as I can, so maybe I can help when she gets tired, when she falls short. I can be the supporting column to help with that.
Absolutely.
In line with this theme, the WHO and what's the other group? Is it
UNICEF.
UNICEF are calling on governments to raise awareness about sustainable breastfeeding environments. Hence what we were just talking about, where the mother is comfortable being on a bus or on a train or even on a plane. I've God help us. I've been on a plane for a flight and watch someone say, "Oh, can you ask that woman to stop breastfeeding her child?" And I'm thinking, and I even said, I had to ask the stewardess. I said, "Did she just really?" Because it was a lady that said it, and I was like, "Did she just really say that?" And she was like, "Yeah." And I said, "Please don't do that."
Yeah.
I said it's not, because she was saying that other passengers were offended by it, and I said, "I'm not.
Yeah.
I'm not. Don't count me in on this."
Yeah.
And she was like, "That's good to know," because she was going, and the stewardess was actually asking people, is that offending you? Are you a little bit awkward? And I was like, "No, don't." I said, "Don't even." I said, "Don't pay that lady no attention." It was one of those moments, but us talking about it, this is 2022, and this is a couple of years back. This is before COVID and all that other stuff.
Yeah.
And I'm thinking, this is still a thing going on.
Yes, it's still a thing. We're still trying to get society to wholeheartedly accept these women if they need to breastfeed their babies in public. it shouldn't be that moms are still going into little corners to breastfeed. Like, we should be providing them with a comfortable space to breastfeed. And back to the point that you said about the sign that displayed breastfeeding welcome here.
Right.
That's one of the supporting ventures that we're rooting for. So different whether organizations would put up a sign just to say that the moms are welcome to come in and breastfeed if they have to, and that will sort of make the whole process a bit easier for mom.
Right.
Yeah.
Exactly. It makes sense because summertime is hot.
Yeah.
I would hate to know that a young child and a mother are out in the sun trying to feed your child while the sun is beating on your back because some business won't allow you to come inside.
Yeah.
That to me sounds draconious. Just saying it out loud, you like, well, no, that is real. That is real, and that's what this is addressing and coming to the understanding about it. Tell me some of the critical components about breastfeeding. How can Cayman, how can we support mothers in this aspect of breastfeeding?
I would say in pregnancy, at the HSA, we do parent craft classes, and there is a session about breastfeeding, so women and the partners can get the information. There's a very good breastfeeding support group on the island, which will give peer support to women. They were doing it over the phone. Hopefully soon they'll be able to actually go back out to people because of the present situation. The midwives themselves, antenatally, and actually when they have the babies, will give support to the women, as well as the neonatal staff at HSA. It's a big learning curve. I used to say to the women that I look after, you've read the book, but the baby hasn't. So they've got to learn and go from there.
That's actually pretty good. I'm going to have to remember that. You read the book, but the baby hasn't. Wow.
Yeah.
But that's the reality. Each and every child and each and every mother, each and every scenario will be different.
Yes, definitely. And yes, it is natural, but it's not always easy. The women just need support from whoever so that they can believe in themselves and persevere, really, because it's, it is harder if some babies just don't want to do it or whatever. And realistically, bottles are babies don't have to put so much effort in, whereas breastfeeding, they have to feed slightly different, and the baby will take the easier option if they can, as we all probably do in life.
Right.
But actually, that's not the best option.
Yeah.
So.
Okay.
And of course, there's the financial benefits. It's free. There's no making the bottles up. You can it's there, ready to go. And another thing is, the women have to realize it's not supply and demand. So it's not like there's like the more they feed the baby, it's demand and supply. So it's the other way around. So the more they put the baby to the breast, the more milk they're going to make.
Yeah.
Okay. And I would think, part of it would be to empower the women to be comfortable, because most times in our head, our brain stops us from doing something that is natural.
Yeah. Yes.
It's there, the society and challenges with that has kind of put a stigma on this. And part of this is breaking away from that idea that, this is just in case of emergency. No, the bottle is the emergency.
Yes.
It's the other way around.
Yeah.
And people, I mean, my listeners are pretty slick to everything. Folks, we're in the middle of a pandemic. We're in the middle of war, grain and food and all this. I just a couple of weeks ago remember seeing, as we talking about formula, I remember seeing them with tainted formula.
Yeah.
And all of these, all of these are byproducts of human intervention into something that is natural.
Yeah.
And so, getting grain and getting food and all of this to make these formulas are in limited supply. I remember, if I can sidebar for a second, that the President of the United States were flying in 747s full of Infamilk because they couldn't find it in the U.S. That's not where we want to be.
No. Because we've got a solution. We've got a natural solution. As we say, not always an easy solution, but we've got a natural solution.
Right.
So we should go with that if we can.
Exactly. And counseling to empower women, one of the things, how can they get access to skilled counseling on island? You said the HSA provides it. How can they get in contact? Say I'm at my wit's end.
Okay, so we do have members of the breastfeeding support group that we give out to all postnatal women in the hospital, and we can give those numbers out in pregnancy as well. And they've always got somebody on call, and they will support the women over the phone if they can.
Okay.
Yeah.
Okay.
And
So
they're
it's
women,
easily accessible.
yes, and they are women who have breastfed, who've been there, who've been that mum when they're at the end of the tether. So they've been there, which really is important, so they can be able to show empathy. And they'll have different ideas, and have you tried this, have you tried that? And sometimes that's all you need, is someone to come up with maybe a different idea, or someone to say, oh yeah, I know it's hard, but you'll get there, and empower the women to do it. I think is important, because when I don't know, Auntie so and so is saying, oh, just give the baby a bottle, that isn't actually the solution.
Right.
Actually empowering the women and helping them to achieve their goals for them and their baby is more important.
And I think, we were talking about the accessibility to skilled counseling. The analysis, tell me about that. I mean, breastfeeding can save lives. As you said, it can stop certain things from happening. There was some, I saw on it was like 820,000 children every year. Tell me a little bit about that.
So worldwide, if they increased the breastfeeding rates throughout the world, 823,000 deaths in children under the age of 5 could have possibly been prevented, and 20,000 annual maternal deaths from breast cancer had those women breastfed their children. That is a lot of women. That's a lot of families.
That's a huge
lot of
number.
babies.
Yeah.
That is a huge number. And it's something that's quite simple, as we're saying. It's breastfeeding.
Yeah, exactly.
I'm not making light of it, but it's natural. And with practice, you get better.
Yeah.
So I mean, I would think, I'm kind of the oddball because I'm a man trying to put into words the idea, but as a man, I would want to support the woman who is in this. I need to learn how to breastfeed. Yes, but it's us, it's we, and we learn better when we have support.
Absolutely. You do better when you have support. And to the point that you're making, the support does help mothers to extend the exclusivity and duration of breastfeeding. Because if mom's getting frustrated, she doesn't have the support, then she might just decide, oh, well, I may as well quit and just give this baby a bottle. But if she has a support, somebody there that's in her corner rooting for her, if she can find lactation professionals that can help her if she's faced with challenges during her breastfeeding journey, then it will make it a little bit more easier for her to want to continue to breastfeed. Definitely skilled breastfeeding support is very important. And I don't want moms to wait until the baby gets here to sort of reach out or, get breastfeeding support. This can be done from the moment you realize you're pregnant. You could start looking into getting information, doing your classes or whatever the case might be, just to get the information to make breastfeeding a little bit,
Excellent. Cayman has a Cayman breastfeeding group. Am I under?
That's correct. Yeah.
Okay. And I would think that they're a great source.
Yes.
For it, and able. I remember at one point in time they have like a volunteer group.
That's right. Yeah. So I feel that it's important that women are also educated about breastfeeding. So some of the sort of science behind it, I suppose. So, for example, pregnant women. And women and new mothers produce more hormones at night, so therefore you produce more breast milk at night. Now, a lot of babies are born at night for this reason. So many years ago, my university lecturer said to me that it was because basically, if you're an animal out in, say, you're a lion and safari or whatever, you go somewhere dark to have your babies, to keep your babies safe. So that's why there's more hormones. And then those same hormones are the hormones that produce the breast milk. So you have your baby feeds more at night because you're then, and you will produce more milk. And so that's why your baby is awake all night.
Okay. That makes sense. That makes very good sense according to, we're animals as we see fit. Yeah. But hormones would be produced more at night, which hence is more breast milk. And most children, 99% of them are more hungry at night than anything. They wake up in the middle of the night to be fed, and in the odd hours that people keep repeating and going from there.
Exactly.
Now, you learn something new every day.
So there is science between why your child is awake all night.
And so if mom is pumping, then between 1 and about 3 o'clock in the morning, or maybe about, probably go as far as saying 6 o'clock in the morning.
Okay.
She would find that she'll have the most milk if she's pumping around that time.
Okay.
Her milk production would be highest. So that's also something to bear in mind if she's pumping.
And I think that's one of the things that people generally forget is that there is timetables for majority of stuff. Once you get into what I call a groove, once you get into a rhythm and a cycle of things, you'll know when you're producing the most. You'll know when your child is hungry the most. And it takes a little time and a little bit of practice to get that up and running based on each child and each parent is different.
Definitely.
Each scenario is completely different from it. So we're going to take a quick break, folks. We'll be right back. Once again, you're listening to Healthcare Today with the HSA. Thank you so much. I have with me, by the way, my name is Chuck Taylor, and I have with me Nurse Carol and Miss Nurse Renae. We'll be back in a few moments.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Once again, folks, thank you for tuning in. We are Healthcare Today with the HSA. I'm your host, Chuck Taylor. And I have with me in the house today Nurse Carol and Nurse Renae, and we're talking about World Breastfeeding Week, which is the first week in August. Is that correct?
That's correct.
Each and every year that they get together and they do this, the World Alliance for Breastfeeding Action. It was initiated in 1992, and I guess the World Breastfeeding Week follows suit with that.
Yes. And so World Alliance for Breastfeeding Action, also known as WABA, they've been a giant in supporting breastfeeding, and yearly they come out with these themes to sort of put forth the support and education that is needed for breastfeeding.
Okay. And the theme this year?
And the theme this year is to step up for breastfeeding, educate, and support.
Okay, and this theme, the WHO and UNICEF, say again? UNICEF. I keep saying UNICEF. UNICEF is basically asking all the governments to bring awareness to sustainable breastfeeding environments. I'm assuming that is public environments as well as private, and promoting women access to skilled breastfeeding support, and also the critical component in the breastfeeding support. And I think, we've had a very frank and honest conversation about it, to say that, women need this.
Yeah.
This is, the children need this. Tell me a little bit about how long a mother should breastfeed.
So, the American Academy of Pediatrics recommends exclusive breastfeeding for the first 6 months with complementary foods introduced around 6 months. And they've just updated their policy for this year. And that new policy says that mom can continue to breastfeed up to 2 years or beyond, as long as it's mutually, desirable between mom and baby. So, but the WHO has always supported moms to be breastfeeding up to 2 years, exclusively for 6 months, and then all the way up to 2 years if she so desired. So let's just say the AAP has just, been in alignment now with what the WHO has been saying all this time.
Wow.
Yeah.
And the reason for this, I would think, is there are so much other things associated outside of breastfeeding, with the poor supply of milk worldwide, like we were talking about, just tons and tons of different things that can arbitrarily hurt the mother and child. So it's best to go the natural way.
Yeah, and so for the moms, again, it's a personal choice. I would support and advocate for every mom to breastfeed if she could. Not every mom can, but for those who can and want to, then absolutely, I would say that is the way to go.
You're talking to a guy here, so I'll just ask, what are some of the common problems that women may find when they're trying to start or already breastfeeding? What would some advice for them be?
So I would say gather the information you need from the get-go. If you're pregnant, just figure out who you'd be able to call if you need some help with your breastfeeding. Support-wise, who's going to be on your team? Is it that you're going to find a OBGYN who supports breastfeeding? Your pediatrician supports breastfeeding. What about a lactation, whether a lactation consultant? You could get information as to where is she? What's her number? Can I call her? Get that sort of information. Take a class. Carol mentioned that there is the
parent craft classes at HSA do cover breastfeeding, so they can support. And it's important that dads know information as well as the mums. So,
Absolutely. So have all of that information already available for you. Don't wait until the baby gets here, because trust me, you'll be thinking about several other things when baby gets here.
Right.
So have that information already available to you. And then the issues that you can be bombarded with when you're breastfeeding. If baby's not latched on properly, you can have poor attachment, and
right.
then.
And one of the things I think that the listening public needs to take awareness is that there are. I did a little background check. The Cayman Breastfeeding Group, they're a great source for support for mothers. And they have a volunteer group that meet at least once a month to offer free support and education on breastfeeding, and to existing and expecting moms. As you said, it's best that they get all of this information prior, because at 2:00 in the morning, you don't want to be trying to figure out what to do. You want to already have a game plan, because sleep for you and the child, is very important also, because the child grows when it's sleeping. So these are some of the things that you need to be aware of and think about prior to hand. And if you're just tuning in, we're talking about World Breastfeeding Week 2022. And I have with me Nurse Carol and Nurse Renae. And we're just talking about some of the issues that moms may have with breastfeeding, some problems that could arise, and you were telling me some ideas of how they can find solutions to it.
Right. So I don't really want to say problems, you know.
Okay.
I'm
a man, so everything that doesn't go right is a problem. and that's part of the problem is that us men think that it's a problem. So we need to be more open mindset and more understanding that the solution is there.
Yeah. Well, a mom can be faced with a few issues or a few challenges with breastfeeding. And, you know, so if she hasn't nailed her attachment down correctly, you know, or we call a poor latch, then she could end up with sore nipples and poor transfer of milk that could also lead to reduced milk supply. So most important is to be able to get a good latch for the baby or, you know, baby onto the breast. And I mentioned if there is not a proper latch, then she could end up having sore nipples. And then she's trying to get her milk in, trying to feed her baby, and then she's also dealing with sore nipples. But a good part about it is, you know, if you have a good support, you could try to reach out to a professional just to see if they could help to guide you through those bumps that you might come up on during your breastfeeding journey. So for sore nipples, she could probably just express a little bit of her breast milk and allow it to air dry on her nipple and allow it to air dry. Some persons do recommend the lanolin cream to be applied. If that's her choice, then she could use that as well. Ultimately, it will have to be that the main issue is addressed, and that is to get a proper attachment.
That's priority.
That's priority. If mom's pumping, pumping can also lead to mom getting sore nipples as well.
And when you say pumping, that means using a mechanical breast pump
to express
the milk. Okay.
Absolutely. If her flange size is not correct, if she's using a pump that's where the flange is too small, or if it's too big and not abrasion with the pump, the nipple moving against the shield could also cause sore nipples as well. So that's also something to bear in mind, you know. So she could be sized for the proper breast shield or the correct size breast shield so that she doesn't have that issue.
Well, one of the things that, you know, there is a educational curve to this. Being the person on the outside looking in, I'm like, okay, I didn't think about that. I didn't know that. But then that comes with experience and talking to people who have been down this road before, to have that understanding, and that knowledge helps you health-wise, but also helps your child health-wise.
Yeah.
And so I think that's one of the things I hope my listeners out there, you know, definitely take with them, is that it can be done. Yeah. It just needs the right amount of information to make it happen.
Right.
And that comes with talking to professionals such as yourselves and people in the industry. You know, definitely reach out to you said, a lactation counselor, you know, some peer support groups, and definitely the health professionals, because all of that is general information for you to take and use to better the situation for you and your child.
And absolutely. So in the hospital setting, one of the things we're trying to do, or we've been doing, is to try to get baby skin to skin with mom as soon as possible, because that first hour, which is what we call the golden hour, you know, if we could get baby onto the breast, it's more likely that the baby will breastfeed. So after delivery, we try to get baby skin to skin with mom, and then try to get baby onto the breast as soon as possible. So try to find out if wherever you're delivering your baby facilitates, you know, these sorts of interventions to help encourage breastfeeding or longer breastfeeding, and that's quite important. You know, hand expression is something else that will come into play. If baby doesn't go to the breast right away, all is not lost. Mom could, you know, hand express her milk so that the baby can have, you know, a little bit of colostrum in in the early stages, she could hand express her colostrum into a spoon. Now, these days, we have fancy stuff like colostrum collectors. She could just pick up one of those. I know one, I'm not promoting any brand, but Haka does have those, and feed that to her baby even while she's in hospital. And I think hand expression is something every mom should know how to do. So you don't have a pump right away, or because even your baby will do a better job at removing milk. Your baby will do the best job. Your hand will do a better job than the pump.
Okay.
And your baby will do a better job than your hand and than your pump.
Oh.
So,
Okay.
you know, I think hand expression is something that every mom should learn how to do. If you're thinking baby's not going to the breast, don't give up. You can hand express your colostrum, feed that to your baby in a spoon, and that's a great start. The colostrum acts as a laxative, and it helps to get your baby to pass out that meconium. There's association between meconium and high jaundice levels. So it's a good way of eliminating jaundice from the body. Let's just say it's liquid gold.
So I'm gonna pause right here now, because I hear knowledge and I like to hear knowledge. So I'm just gonna be and ask something personal. How long have you been in the industry? Because you ladies are quite knowledgeable. You could be generous with it, and don't have to tell us your age or anything like that. But just the idea of how long you've been in the industry, and specifically in the nursing baby, I guess pediatric idea.
So I've been a pediatric nurse for my entire career. I started out in pediatrics with the toddlers, and then I moved over to the neonatal intensive care unit. So I've been doing this for 12, 13 years. But I've also gone on to do further studies. I started with doing the Baby Friendly Initiative course, and that's specific for individuals hired inside organizations that want to promote breastfeeding. So that was my first step.
Okay.
My second step was to study to become an international board certified lactation consultant. So I'm a certified board lactation consultant, and I've been I've been preaching, supporting, empowering women to breastfeed, and that's my mantra. I will always be doing that. I believe you can. If you want to, I will support you.
Practice is the key.
Yes.
Practice is the key.
Yeah.
And Miss Carol, you want to give us a little bit of
Yes,
information?
definitely. So I've been a midwife for 17 years. Before that, I worked in a bank, so a completely different career. And I recently come to the island in last November, and I'm from the UK.
Okay, excellent. And see, the thing I think about it is what you're telling me has so much passion and core of it, the understanding, because my family, my youngest one is like 15, and back then it wasn't promoted as much. It was there and it was known and it was understandable, but I think the information that I'm hearing over the recent years has been more easy. Maybe because the internet is there and people look for things more, or but back then it was told to you, you were helped, but it wasn't the level that I'm hearing now.
I would agree with you, Chuck, on that. I do believe that it's being talked about more. I mean, it's a public health issue, just like you talk about, vaccinations. I know that could be a sore point for some people, but, even just general stuff like feeding, kids and that sort of.
Yeah, that's fine.
But it's a public health issue, and I think we should be having this conversation way more than we're having it now. But the good part is, or the good thing is, it's being had.
Right. The conversation is being held now.
Yes. But
because I'm trying to think if I've ever had in my radio career talking about breastfeeding, and I'm hard pressed to think that outside of a convention or something like that, it's hard pressed for me to find a conversation outside of that, unless someone was having a child and you had that initial conversation.
Right.
It wasn't a general topic
I know
across the board. And I think that's progression.
Yeah.
And I think that's good where we are. The conversation is being held because there may be somebody out there who doesn't know how to start that conversation.
True.
And I think, you ladies are a testament to the industry and the understanding that this is something that is needed.
Yes.
This is something that definitely, we're talking about something that is the health, the longevity of a child. And I remember doing a study many years ago saying that children that breastfed more intellectual to understanding. In other words, they grasp things quicker. They were better healthy. So what you're saying isn't new to me, but how you're bringing it to the forefront, I think, is a conversation that needs to be held more.
And in addition to that, I just think it needs to be promoted, socially, culturally, in organizations. Policies need to be geared towards encouraging breastfeeding, supporting it for those families.
Let me ask you, you brought in a word that I synonymously entailed culture. Is it more cultural? Because, we live in the West Indies. Is it more culturally acceptable here or not as much? Or does it depend a little bit on the person rather than the environment that we're in? Or how do you see that? Because as I said, I use the U.S. as a standing point. I was traveling for many years, DJing and different things like that. Yeah. And I was always in awe that they were not progressive with breastfeeding. To me, I said draconius. In some cases, it was. It was literally like, oh, she's breastfeeding. And I'm like, and? Yeah. I'm riding the train in New York and a lady's breastfeeding, but she was of an ethnic background. Yeah. But people were like, I can't believe she's doing, and I'm like, this isn't, in my mind, I'm thinking, this is nothing, I'm in New York City riding the train. Yeah, to me, that's more scary than a woman breastfeeding a child on the train, the question I'm trying to, I guess, convey is it more culturally acceptable in other regions than the modern, I'd say U.S., but you know what I mean.
When I worked in the UK, I worked in a city which had quite a lot of Somalian women. You never had a Somalian baby that was reluctant to feed, ever. They always just fed. So in Somalia, all the women breastfeed. You've seen your auntie do it. You've seen all your neighbours do it since you were a little girl. Yeah. It's just the norm. And until we get to the point where it's the norm, and I think we're a lot better than we were. I think we've moved on a long way from when babies used to be fed in what you call restrooms here. Because that's what used to happen. You wouldn't go and eat your lunch in the toilet. So why should a baby? Yeah. So we've moved on from that. So that's great, and I think we're getting there. Yeah. But I think we've got a way to go. But we're going the right way. I think.
We're going the right way. Yeah.
One of the things I think, and that's the right attitude and the right understanding of it moving forward, because once again, it's a personal choice. Yeah. But then that personal choice is also reflective of your culture. If you've seen your family doing it, then you're more ample to do it yourself.
Absolutely.
If you see, everyone breastfeeding their child from time you can remember, and that's the normal, whereas versus, and I'm not saying that one is better than the other, but health-wise, yes. Yeah. Culturally, I can't say, oh, you should be doing this, but then you've seen your aunts and your mom and your sisters and everyone else breastfeeding their child. You're more ample to do it yourself.
And I know we're in a fast-paced society, or at least in a time in our lives, and women might think, oh, well, I don't have time to sit down and breastfeed, because it does take time. Well, you could think of just exclusively pumping and feeding your baby, just baby still getting your breast milk, so you could exclusively pump and just feed that to your baby. That's another, option that you could look into if you don't want to have baby attached to your breast.
Right, time-wise, as you said, everyone is, I got to get it done, I got to get it done. So, in that, with that being said, how long can breast milk stay viable?
So, Moms can store their breast milk if is fresh breast milk she just expressed. I would say you could store it outside room temperature on your countertop in your kitchen for 5 hours. Inside your refrigerator, and I don't mean inside the door, I mean inside the refrigerator, 5 days. And in the freezer, a deep freeze, you could go 5 to 6 months in the freezer.
Okay.
Now, I'm not encouraging any moms to feed the refrigerator. I'm encouraging moms to feed the baby.
Right.
So don't look at those moms who have a full freezer full of breast milk. Your breast milk is for your baby. So give that milk to your baby. Don't compare yourself to anybody else. Everybody's on a different journey, believe me.
Okay, excellent. And that's one of the things I think that is the plus, and probably the scary part about it is that each person is different. So you need to figure it out for yourself. You can take the information, you can work with the information that's given, but your ultimate journey and your time frame is based on you. So once you start it, you'll figure out, hey, okay, this worked for me, this didn't work for me, this, latching on was good, this wasn't able to latch, so I'll be able to express it this way. So each person is different, and each lady, each woman would be individual, but the overall knowledge, I think, is the general key to it. Yeah. So that the more knowledge you have, the more informed you'll be to make the right decision and make the right choice on that path, because there are multiple ways of doing things, and the solution is there. And with a little help from the experts, y'all ladies, thank you so much. It makes it so much more understandable, and even for me, I right now I don't have anybody I can think of who has a young child around me, but I'm glad we're having this conversation, because somebody out there has had a baby in the last 6 months.
Absolutely.
and I'm sure, there are challenges to it. So I'm glad we're having this conversation right now. Okay. With the pandemic going on, I hate coming back to that, but, this is one of the things we said earlier. If you're just joining us, thank you so much. That one of the common problems is not just outside of the pandemic, but just a poor milk supply overall for production of the preempted, pre-mixed stuff. That itself is a problem. So that's an encouragement for you to go ahead and start breastfeeding the child. Make sure that you have that, and it's more healthy for the digestive system for a child to be breastfed. Is that correct?
So you're making reference to the formula shortage that we were just experiencing.
Yes.
Yeah, and it definitely it's more healthy for mom and baby if mom's breastfeeding. And out of that, we've had women who breastfed in the past who went back and they decided they want to what we call relactate. Mm-hmm. So you were breastfeeding or you were producing milk and you've stopped, and now just with stimulating the breast, these women can start producing milk again, and just to help babies in situations where there weren't any formula available to feed these babies. So it definitely, breastfeeding did come in handy in those situations. And I know coming out to Ukraine, that was also something that women were doing just to help moms that were having a hard time there, feeding their babies. So, yeah.
Okay, so we know that sometimes mums are a little bit concerned that they don't know how much milk their baby's having, whereas if the milk was in a bottle, they'd be able to see. But the best indication of how well your baby's feeding is your baby's behaviour. So if your baby settles after a feed as having wet and dirty nappies, is generally nice and active and alert, that's the best indication that the baby's getting enough milk.
And to that point, Carol, I want to talk about hunger cues. How do you know when your baby is ready to feed? So your baby will start stirring and, what we call rooting, where they're putting the hand to mouth, and sort of searching for food. But those are early cues, or some early cues that your baby will be interested in going to the breast. By the time your baby's crying, that would have been a late sign that your baby is hungry. A closed fist means that your baby is also tense and wants to eat. But once your baby is full, satisfied, then those palms open out and your baby's relaxed and probably will just drift off to sleep.
So we're going to take a quick break, folks. We'll be right back. Once again, you're listening to Healthcare Today with the HSA. Oh, by the way, my name is Chuck Taylor, and I have with me Nurse Carol and Nurse Renae. We'll be back in a few moments.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. And we have with us Nurse Renae and also midwife, Miss Carol, Nurse Carol. We are here talking about World Breastfeeding Week, which is the first week in each and every August from the 1st till the 7th. And this is something that is, sounds simple, but there's a lot of involvement in it. There's a lot of stigma that has been around it for many years. And part of our job is to break that stigma and empower these young mothers and our older mothers, doesn't matter, empower these ladies to feel comfortable. And you were just talking about that, right, Miss Renae?
Yes, I was mentioning that women should be more open to breastfeeding in the sense that you're breastfeeding, but you're not just breastfeeding because your baby's hungry. You're breastfeeding your baby because it's cold, because, it's in pain. It's enduring a stressful situation. You're providing comfort. It's okay to breastfeed for comfort. All the other mammals have their babies going with them all the time. These babies want to be cuddled, want to be loved, want to be with their moms all the time. If you can carry your baby, I encourage moms to strap their babies on while they're home, and you're just do what you're doing around the house as long as it's safe with your baby there. That's what your baby wants. It's okay to breastfeed for comfort.
And I think a lot of people forget the simple things are the best.
Yeah.
You don't think about it. We in this modern era, we spend so much time being modern. Mm-hmm. You have a rocker, you have this, when you yourself are the rocker. Yeah. You're it. Yeah. And it's kind of a throwback to I tell people, I say sometimes, progression means understanding that you don't have to use that high-tech tool, yeah. that high-tech thing, because holding a child is one of the most comforting things and natural things ever. A child will go sleep quicker when he, like they did a study with a child listening to a heartbeat, And a child could tell the heartbeat between its mother and someone else because of that reason.
Yeah, that closeness. And so I'd love us to get away from, when we say that, oh, baby's breastfeeding for comfort. I mean, if mom doesn't provide it, then who else is going to provide that comfort for baby? It's fine. If your baby So there's not many things that breastfeeding can't solve. If you don't know what it is, breastfeed. If you know what it is, breastfeed. You'll be fine. Baby will be fine. So.
And I think that's a good way for us to start wrapping up. In closing, Miss Carol, any parting words that you want to say?
So I just thought I'd like to share with you. The other week I was at Smith Cove and I saw this most amazing woman. So I think she must be the breastfeeding champion. She was breastfeeding her baby in the sea while she got her little toddler holding her hand, and then she's got the baby and she's breastfeeding while she stood in the sea. And that's how it should be.
That's empowerment.
Yes. Absolutely. I think you're going to have to bring us back for another part here, Chuck, because there's so much to talk about when you think about breastfeeding. Now, one of the things I want to address is, when moms are going back to work, we absolutely need to have a space for moms to be able to express their milk while they're back at work, because then if we are encouraging them to continue feeding their baby at least up until 2 years, well, let's just say 6 months at the very least, they need to have that support. Let's provide them with a little space so they can go get some time to express their milk so that they can have milk for their baby.
Right.
Additionally, I think insurance companies just need to, step up to just to support moms in the sense that they will cover lactation counseling or lactation support for these moms and help them to get a breast bump. I mean, they're doing it in other countries. I think we could look at that to come here.
And I think that is a great parting words. Looking forward to the future. These are questions that you, the public, can bring to the powers that be. We're having an honest conversation as always. Want to thank you, ladies, for stopping by here today. Thank you so much.
Thank you for having us.
Thank you.
And once again, you're listening to Healthcare Today with HSA. I'm your host, Chuck Taylor. Thank you so much for tuning in. We will be back next week, same time, same channel. Keep it right here.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health, because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.